and welcome into Cullman today. I'm Debbie Wood. Our very special guest this morning is Dr. Araujo. He is a podiatrist. He is actually affiliated with Cullman Primary Care Foot Clinic, and we're going to learn all about him this morning. Good to see you this morning.
Good morning to you.
I've seen you before, met you, but it's been a long time ago.
Ma'am.
And we want to talk a little bit this morning. We want you to share with our audience a little bit about you and your family.
Okay, be happy to. Well, let's see, where do I start? I guess I'll start at the beginning. After graduating from the University of Maryland in psychology and pre-med, I did my medical school training at Temple University School of Podiatric Medicine, and that was a 4-year school, as most are. And then did my residency at Wellington Regional Medical Center in West Palm Beach, Florida.
Okay.
Didn't really like to change the seasons, or the no change of seasons there, so did work a year in Philadelphia.
Oh, wow.
And yeah, that was, it wasn't
definitely had change of seasons there.
Very much so, mostly cold though.
Absolutely.
But after that, spent probably 13 years in 2 practices, and after that I joined Cullman Primary Care Multi-Specialty Group in 2011.
2011.
Yes, ma'am.
Let's talk a little bit about your family. You have a wife and 2 children?
Married to my best friend, Lisa Marie, and we have 2 kids. The youngest is 14. Hi, Sierra. And the oldest is 26. Hi, Robert. Do your homework.
And absolutely. And hey, that is amazing to me. I had to tell you this when I sort of previewed this sheet a little bit earlier. I cannot believe that he has a 26-year-old. It's hard to believe. Wow, you just look like you're 26.
Too kind, too kind.
You look very, very young. I've got to know this. How in the world did you end up in Cullman, Alabama, or even in Alabama?
Well, long story, but I'll give you the short version.
Okay.
After I was practicing for about a year in Philadelphia, I did get a call from a classmate of mine who was practicing with a group here in Alabama. Okay. And that kind of started it. Wow. We live in Gunnersville, actually. Okay. That's where we first moved to, and we love it so much that we can't get away from there.
You can't get away from it. And the kids, of course, have been in school, especially your younger ones. So that would be tough. That would be tough. This is Foot Awareness Month. The month of April is Foot Awareness Month. Do you have any specific items to talk to us about as far as foot health? I know it's an important thing.
Yes.
People, sometimes we just sort of take that for granted, that that's not important, but it is.
You are exactly right, and I see that quite often in my practice. But I like to kind of spin that a little bit and change gears somewhat, because I want to talk about a topic that if we spent 12 months talking about, it still would not be enough. Sure. And that's diabetic foot care. Okay. The reason being is that the population of diabetics in the United States is probably about 23 or 26 million. Wow. And it's growing. And you would say that diabetic foot problems are very prevalent in the United States. And again, it's only growing. Right. In fact, 15% of diabetics will have a foot wound or an ulcer in their lifetime. To put that a little more closer to home, in Alabama, the population is roughly 4.8 million. Right. Of those, 576,000 have been diagnosed with diabetics. Now, that's just diagnosed. There are probably, obviously, a lot that have not been. But of those, 15%, according to the statistic, will develop a foot wound in their lifetime. That's 90,000. Oh, my. That's staggering. Unbelievable, isn't it? Yes. Unbelievable.
Diabetic foot care is so important if you have been diagnosed with diabetes for so many reasons, because if you don't take care of your feet, that can lead to other things, right?
Yes.
I mean, share with us a little bit about that, why it's so important.
Well, the importance is that besides diabetes being the 7th leading cause of death in the state of Alabama, it's also the leading cause of leg amputations that are not related to trauma. Right. And the staggering statistic behind that is that if a diabetic loses their one limb, their 3 to 5 year survival rate, their survival rate is 3 to 5 years after that. Goodness. Yes, and that's worse than breast cancer. Oh, absolutely. That's why it's so important.
Well, why are people with diabetes so susceptible to foot wounds? Is there Are they not taking care of their feet, or is it just something in their system? Or
good question. There's a few reasons that are most common for diabetics to develop foot wounds. Right. One of them probably the main cause is diabetic neuropathy, which is poor sensation.
Okay.
The second one, poor circulation, foot deformities, or a combination of diabetic neuropathy and foot deformities.
Oh, wow.
Because if someone can't feel their feet and say they're wearing tight-fitting shoes,
right.
that will develop first a callus, but they don't feel it,
right.
and that will eventually lead to an ulcer, which can become infected.
Oh my goodness! So it's so important. Once you've been diagnosed with diabetes,
yes.
do you typically, once that happens, does a person, are they just checked out totally, including their feet, typically?
Yes, and it's interesting that you asked that, because many times a diabetic first gets diagnosed by a foot specialist who notices that a person may have poor sensation on their feet.
Really?
Yes. And then usually they may be sent for blood tests, and then we discover diabetes.
And then you go from there. Well, I did not realize that. Diabetic wound or foot wounds, can they be prevented and or treated, or how do you treat them? Yes.
Now, prevention should be the most important thing to do. That's the key. But in terms of prevention, diabetics with foot deformities, any areas of redness or calluses, those things should not be ignored.
Right.
They should see a foot specialist right away. What can we do once those things occur?
Right.
It's not really a death sentence at that point.
Right.
We can do things to prevent those. One is diabetic shoes. Okay. And they can either be non-custom or custom molded.
Okay.
Those with foot deformities may require custom molded shoes.
Okay.
Paddings. Sometimes those areas of redness are not necessarily related to pressure, but they may be related to a skin condition.
Okay.
Infected toenails can sometimes be a problem. I've seen lots of diabetics patients who try to treat themselves and end up with an infected toe.
Oh my.
So prevention, in terms of prevention, I can give you probably a few pointers. One, wear shoes that are not too tight.
Right.
Two, don't try to take care of problems on their own.
Right.
And three, check your feet daily. And not just feet. I tell all my diabetic patients to check their shoes, because the inside of the shoes can hide several things. I once actually had a diabetic patient who developed a foot wound because he put his foot in a shoe that had his glasses in it.
Really?
Yes.
And did not realize, because the sensation.
Exactly.
The feeling was not there. Oh my goodness. That is unbelievable. Well, shoes specifically, if they're not a diabetic shoe for diabetes, but what about that shoe is important? Is it the softness, good support? I mean, what if you don't get a good diabetic shoe?
The shoe, it's not the diabetic shoe per se that gives you the support, but the insoles.
The insoles.
Yes, they come with a material called plastizote, which is heat conforming, and it can conform to areas of pressure on the bottom of the foot.
Okay, okay. Making it more supportive, making it more comfortable, I guess?
Exactly. Now, in terms of treatment, once a diabetic patient has an ulcer, I gauge that, can this ulcer heal within 4 weeks? Because up to 4 weeks, that's still a wound that's pretty acute.
Sure.
If it can, barring any circulation problems, then we can use conventional wound care treatments like certain dressings.
Okay.
But once they reach 4 to 6 weeks and the ulcer is still not healed, then they need advanced wound care.
Okay.
Now, what's advanced wound care? That's things that we can use at the CRMC Center for Wound Healing.
Okay. Aren't we so proud to be able to have that?
Yes, it was much needed adjunct to treatment of this pathology.
Absolutely.
We have things like specialized dressings, specialized ways where we can keep the diabetic patient off their foot, like offloading, like total contact casts. And one of the most important things, hyperbaric oxygen chambers.
Exactly, and we're just so blessed to be able to have that in our community. It's just, it hasn't been at CRMC that long, a couple years.
And I do have to say, I'm sorry to interrupt, but
that's good.
The staff we have there is phenomenal.
Exceptional.
We have a great program director, great clinical manager, and 2 great nurses there.
They believe in what they're doing, don't they? And just the fact that our patients don't have to travel out of town, that was the main thing that I was thinking, wow, that has to help the patient and the families.
Yes,
make a big difference.
Exactly.
Why is it that a diabetic patient are more susceptible to wounds? Is it just poor circulation there again? Or
well, I think that's a common misconception. Okay. Not just poor circulation, but the primary reason is actually or a loss of what's called protective sensation. I can't feel what I'm stepping on, associated with the deformity. And actually, in literature, 3 main reasons are noted for development diabetic foot wound, and they're called the critical triad. The foot deformities, poor sensation, and trauma. And trauma can be an ill-fitting shoe, it can be stepping on a nail.
And not knowing?
Exactly. Or it can be dropping a weight on their foot.
Oh my goodness, so you don't even think about that. Well, let's talk just a second about why you have a passion for diabetic foot care. I know, and this is good.
Yes. So. Well, I think I've always somewhat been interested in diabetic foot care, but my real passion developed after my wife's grandmother developed a foot ulcer. Unfortunately, she had an infection with that foot, and we were in Alabama at the time, and she lived in New Jersey. And with that infection, she unfortunately had her leg amputated.
Oh my goodness.
Shortly thereafter, she died. I think the thing that kind of developed my passion was that I had an opportunity to discuss the case with the podiatrist who was treating her, and also the medical doctor on the staff at the hospital. So it was even though I was not directly involved, it was a collaboration. And I tend to be very collaborative even in treatment of my patients. And with diabetic foot care, and that goes along with prevention and treatment. I can't treat them on an island. I have to have the help of primary care physician, internists, diabetic educators, and nurses.
It's just a good team, isn't it?
Yes, it's a team approach.
A good team, and I'm so sorry that happened to her, but I'm so glad that you were able to. I'm sure you've learned from that so much.
Absolutely.
And in the past, I've heard so many people, family members in our community that years ago did not have what we've got today, which is you and the other team members at CRMC that works with our diabetic patients, and I think it's a wonderful thing.
I have to, I think I'd be remiss if I don't mention a few names that are huge contributors to the treatment of diabetic foot wounds. I forgot to mention 2 people at the Wound Care Center, and I don't want to forget them. Connie, who is our HBO tech, she did a fantastic job, and Terry at the front desk, who's so warm and inviting to patients.
Wow, that's wonderful.
And the other person at the hospital is Christy Reeves, who has done a great job with wounds for years, and she's a wonderful adjunct to have on the floor.
Wonderful. Well, thank you to you for what you do, and of course thanks to all of those wonderful people at CRMC, not just your department, the primary Cullman Primary Care Foot Clinic, but also with the Wound Center there at the hospital. Without all of these great people, it would not be possible to do all these things that we do in Cullman. We want to say thank you.
Thank you very much.
For joining us this morning.
My pleasure.
You drove all the way over in this terrible, terrible rain this morning, so we're just glad you made it here safe.
Thank you.
And it's just good to see you.
Likewise.
Thank you. And of course with us this morning, Dr. Araujo, Cullman Primary Care Foot Clinic. We'll be back with more of Cullman Today right after this.